My name is Catherine Battaglia, and I'm doing my quality improvement project on nursing handoff reports, specifically in home care. A little background about me and my line of work. I graduated in May of 2018, and I work for a private nursing company specializing in newborn care. Specifically, families call in and hire nurses to come to their homes and resume care of their newborns overnight so that mom and dad can rest. It is rather challenging to think of a quality improvement piece for my line of work since each home is so unique. I really have yet to run into many issues while at work. Although my job is not on a busy clinical unit where I can make a difference in many people's lives at once, I fully commit myself to the families I work for, and I do my best to provide the most beneficial services to them. That is why I think that this quality improvement project is so important, because I really want to do the most that I can for the families I work for. Also, side note, the newborn in the photo is not a client. He is just a friend of mine. One quality improvement issue that may affect patient safety is the lack of nurse-to-nurse handoff report. This happens because a lot of our families do not have nurses every single night, so there is not always a handoff if a nurse hasn't been there in a few nights. A lot of our nurses also work other jobs, so they oftentimes don't find time to make that handoff happen. When there is no handoff report, this takes away valuable time from the parents, because then the parents have to come in and explain everything to the oncoming nurse regarding the care of their newborn. This may make our nurses seem unprofessional, which will lead to a distrust in the parents to the nurses, and can lead to stress and poor outcomes. Some supporting evidence behind handoff reports include Lewin's force field model. In January of 2020, the percent of confidential email handoff reports will go from the current rate of 0 to at least 50%. Ideally, each nurse will communicate directly with the next nurse who will be working with that patient later on that night in order to decrease gaps in communication. For change is the most relatable. One way to implement these strategies is to allow for nurses to see the schedules of all the nurses that work for a specific family, to see who's coming on and who's leaving. And we can communicate by sending confidential emails to one another. The Joint Commission suggests that nurses use a standardized handoff report to promote that the correct information is being handed off, such as SBAR, situation, background, assessment, and recommendation. This will mainstream the information that is being passed off to each nurse. To my topic because of the nature of the simplicity of it. The people involved are the nurses from both the previous shift and the oncoming shift. Materials include the information to pass off, general patient info, quirks about the baby, tips about the environment. Other notable piece about the diagram is the equipment aspect. As previously mentioned, computerized charting can be misunderstood and sometimes malfunction. That includes cell phones, poor service areas, which also ties into environment as well. And then on the right, as you can see from the charts, there is an inverse relationship between handoffs and miscommunications. The number of miscommunications decreased when handoff reports increased, which is a positive outcome. I made the goal of miscommunications 0, which is most likely not possible, but that's okay because that means there's always room for improvement. His model, since it only has my references include 3 steps. Finkelman states the theory of force field analysis to my presentation on handoff reports in home care. Again, all of these babies are friends of mine and not actual clients. Thanks again. The end. Analysis is used to improve the change process. In this analysis, the manager and staff identify the driving forces or factors that will help to improve the situation in the direction of the anticipated change or outcome. To be effective, this should be a collaborative process between the manager and staff. This model works well for my company since our nurses have such a close-knit relationship with our managers, who also happen to be the founders of the company. The first step of the model, the unfreezing stage, is when awareness is brought to a certain problem and identifying if others feel as though there's room for improvement as well. This will happen during the next staff meeting. Since we all work in clients' homes, we never really get to see each other. The second stage of Lewin's model is the working stage, where goals are identified and worked towards. We will do this by identifying if there needs to be a solution in place to communicate information from nurse to nurse, and we will troubleshoot some of the proposed strategies. The third stage is when the change is in use and incorporated into the daily events of the team, or I should say nightly events of the team.